Hi, I'm Dr. Jeff Waldron. Today I'm going to talk about flexibility and looking at all your joints from your spine to your upper extremities and your lower extremities to make sure you're not losing function. We know that as we age, one of the biggest things we start to lose is our flexibility. Our joints, our muscles, our bones, our skin even is made up of connective tissue that has ground substance in it, which holds water and allows us to move and be mobile. As we get older, we start to lose that, but we can do some things with physical therapy to try and help improve our mobility, increase that ground substance, and stay a little better hydrated so that you can move better and you're not having pain and lose function. So if we go ahead and take a look, when we're in our 20s and 30s, we quickly start to lose maybe a little bit of bone density, we start to lose a little power and strength, but our flexibility starts dropping off even before that and we start losing mobility. So even in your 20s, you can lose mobility, especially if you have a job where you sit for the bulk of your day and you're not moving around much. You're starting to lose mobility in your hips, your knees, your spine. And then as we progress into our 60s, you're really starting to lose a lot of mobility. So some of these tests that I'm going to go over are a great way to check your mobility and make sure you don't have any deficits that you maybe need to seek out physical therapy for. So I hope you enjoy these tests and you can practice these carefully at home and do what you can and what feels okay without hurting. First simple test is let's just see how mobile your spine and your hamstrings are with bending down to the ground. Can you bend forward, pulling your belly button in and bending through all these segments, reaching down and touching the ground? If you can touch the ground, then you pass. If you're more up in this area, then maybe you need to work on your hamstring flexibility or your back. Check is the knees and the back together and see if you can squat down. So can you come in and squat all the way down, keeping your heels on the ground? Can you squat all the way into a full squat, bending your knees? Do your knees allow this? Do your hips allow this much mobility? So if they don't, then we may need to stretch the hips and knees or get a little more strength so you can get up and down off the ground or to lower surfaces to check that. So if we're checking the knees, another thing we can check are the elbows. Can you bring your elbows up and touch the back of your shoulders and flex your arms like so? That's a good way to kind of check that. The other thing we can check are shoulder mobility, if you can raise all the way overhead, or if you can go ahead and bring one hand behind your back and touch the other hand so that you're here like this touching the hands. You should be able to reach those two hands together and have enough shoulder flexibility to reach those two areas. And then the last couple I like to check are the wrists and the foot and ankle. So with the wrists, can you bend your wrists all the way forward and back? Could you press them against the wall, bending forward and back to make sure you've retained that mobility? You can also check your feet if you can bend back like so, or can you go up on your toes? If we want to make it harder, we could get down on the ground and check, or go ahead and check if you can bend your wrist and put a little weight on it carefully. Spreading those fingers opening those to make sure you can weight bear through them. You can also check your feet, see if you can bend or even flip the toes over backwards and see if you have enough mobility in this position to kind of hold that, and that'll engage your stomach a little bit. If you found that any of those positions or tests for flexibility were limited and you weren't able to do them, then you could practice the positions in themselves to start stretching and working on your mobility. When you stretch, you need to remember that short, briefer stretches are certainly safer. You want to be able to still breathe and get oxygen to the muscles as you're doing those. I would recommend stretching less than 7 to 10 seconds, shorter bouts at first. A long, prolonged stretch, you can sometimes damage the tissue and tear it with long holds, which a lot of people don't realize. They get in, they hold, and there's a lot of research all around stretching and what's helpful, but we know that prolonged overpressure stretches can sometimes tear tissue and injure them further. So start with short, brief bouts and be nice and careful with your stretches, and certainly get some guidance from a physical therapist if you found that you limited in any of these areas, to make sure there's not some underlying pathology or injury going on in order to guide you. And I hope you work on your flexibility and getting hydrated with drinking plenty of water so that you can stay active, powerful, strong, and keep being active as you age and not winding up injured. So if you enjoyed this video, please share it with your friends and family, and thank you for watching.